Cashless for all, cashless everywhere. So cashless is the beautiful service which insurance companies are providing to the customers, where when they get admitted due to any illness, they are able to come out of the hospitals without having to pay any cash. So cashless everywhere, cashless anywhere is the agenda of the IRDAI also, and we are happy to tell you that almost 88% of our claims are currently being settled in the cashless mode. As we have seen in the video, the company has settled more than 1 crore claims since inception way back in 2006, and totaling to an amount of 44,000 crores. 44,000 crores has been paid out as claims from the beginning of the company's foundation, and more than 17 crore lives have been covered by the company since inception. 85% of our business is mostly retail oriented and agency driven. We are proud that we are able to reach to all kinds of public and give them products and services which are necessary for them. I will showcase some of the innovative products that we have launched over the last many years. But not only is the company known for its products and services, we are also a company which is strongly grounded in our financials. We are a public listed company from 2001, and last financial year we have had very strong results in terms of our performance. We are a company which is aspiring to not only grow faster than the industry, but we also want to grow with profits. So we have reached an IFRS ROE of almost 17.7% in the last financial year, 18% growth in GWP last year with 15,254 crores. Our solvency, which is the bedrock of any financial services in company, is very strong at 2.2 times. IRDAI requirement is only 1.5 times of the net worth, of the liabilities. We are strong at 2.2 times. And our profit after tax in the last financial year was 845 crores, which was a 37% growth over the previous financial year. So friends, we have reached significant milestones over the last 18 years, but our dreams and our aspirations are not limited by what we have achieved. It is insurance penetration, especially health insurance penetration in India, is still very limited. We believe that the headroom for making more progress is much available. You have also seen many companies and many new applicants are also coming into the health insurance industry because the opportunity is very large. So we aspire that whatever we could achieve in the last 18 years, we want to double that in the next 4 years. And this is the internal targets that we have set for ourselves, that we could achieve 15,254 crores in the first 18 years. We believe that with the growth and the strategies that we have in place, we should be able to reach at least 30,000 crores in terms of GWP by FY28. How are we going to do this is something that we already have our strategies in place. Most of it will come through more and more penetration into the rural markets, making our market share become larger and larger in the urban markets. You will be happy to know that Star Health is a market leader not only in Tamil Nadu, which is our home state, but in almost all the states in the country. So we are a market leader in the retail space. And as you will see from this chart, the standing of Star Health is in retail health insurance in last financial year. We are at least 3 times larger than the next largest company in terms of our retail business. So we are a large retail company selling policies to individual customers and their families, and having a wide range of products, more than 57 products, which is catering to all the segments of the society. So we have products which is catering to young people, we have products which is catering to senior people. We have products which is catering to healthy lives. We have also products which is catering to people who are living with some kind of diseases. We have products for high income, and we also have products for middle income and low income groups. And finally, we have products for people living in metro cities. We also have products for people living in rural markets. So this is the range of products that we are having across our companies, which is catering to all segments of the society. And our claims management, just want to touch upon quickly. Some of this you have already seen. More than 1 crore claims paid since inception. Last financial year itself, we have paid more than 17.5 lakh claims in the FY24. And almost 9,000 crores of claims was paid last financial year itself. We have more than 30,000 healthcare provider network footprint, which consists of hospitals, diagnostic centers, clinics, doctor clinics. Star Health is providing not only inpatient hospitalization coverage, but also outpatient coverage also. So customers can go for doctor visitation, for medicines, for diagnostic test. All of this is also getting covered in some of our products. More than 10,000 hospitals have a rate agreement with us, which we are calling as agreed network providers. Totally digital focused company with entire claims process is done through digital processes. Customers can submit their claims documents on WhatsApp. Most of the customers are anyway going for cashless. As you have seen, 88% of our claims is cashless. But even if somebody is going for reimbursement, they can submit through our digital platforms that we have created for customers. 4 claims are approved every minute in our company. More than 5,000 claims are paid every day. More than 25 crore claim is disbursed every day. And cashless approvals are given in less than 2 hours time in 94% of the cases. So this is the current setup we have. Of course, we are continuously improving our processes through the technology that we are making. We were the pioneer to launch this telemedicine services during COVID. In fact, we launched it before COVID. During COVID, this service came of maximum usage to all our customers and also non-customers. We are currently also offering this service to the public who are not even our customers. So this service is given through our in-house telemedicine setup and managed by our in-house doctors. So we have expert medical of various specialties in the telemedicine field, and also we have dedicated team for providing relationship management to our network of hospitals and making sure that frauds and abuse are limited to the extent possible through our team management. Our product innovations I've spoken about. We are very proud that we are able to provide products for all segments of the society. We truly believe that health insurance is not only a commercial business, but it is also a societal service. And health insurance is the growth driver for the entire insurance industry in India. And you can see that the general insurance industry, the largest segment now is the health insurance business, and also the fastest growing. So health insurance needs lot of innovation to cater to different people in the market. So we have launched the beautiful products over the last years, and we are continuously finding new innovations to cover more and more segments of the population. So some of our unique offerings are the senior citizen plan that we are having. More than 75 up to 75 years of age individuals can buy a Star Health insurance policy just by a click of a button. No medical checks, nothing. So this is one of our unique plans which is available for the senior citizens. We also have very beautiful affordable plans in the rural markets, in the tier 2, tier 3 semi-urban towns. We are able to give this rural products. We recently launched a Star Women's Care Insurance Plan, which is focused towards the women population. Of course, it offers a lot of innovative coverage, which is otherwise not available in other products, like ART treatments, in utero surgeries. These are some of the innovations that we have been able to bring to the market because of the high levels of expertise and knowledge that we have within the organization, both in terms of our manpower as well as in terms of the data that we carry over the last 18 years. And we have a beautiful product for the younger age group called Star Young Star. This is targeted towards a younger profile of customers, gives them good benefits, and also gives them a lot of rewards in case they are taking care of their health. Some of the specialized product offering that Star Health has launched over the last many years is a diabetic care. Now today, diabetic customers, India is the capital of diabetes and hypertension and some of the other diseases. But today we are able to offer insurance to somebody who is a diabetic for even 25 years. They can apply for a Star Diabetic Care Plan and cover themselves and their family members through this plan. We are the first company in the entire Southeast Asia to launch a cancer policy, first of its kind, which covers cancer survivors. You might have heard of cancer policies which are basically given to healthy lives. In case they get cancer, some lump sum amount is given. That is not what I am talking about. I am talking about people who are survived cancer, stage 2, stage 3, stage 4. We are able to give them insurance coverage for the first time in the country. This is a unique product and one of its only one in the market. And similarly, we are also providing facilities to people who have had heart surgeries, who are cardiac patients. Generally, cardiac patient yarume insurance policy kodukka maatanga. But Star Health Insurance was the first company which brought a product which is also covering cardiac patients, heart patients. So these are some of the innovations that we are bringing to the market depending on the needs of the society, and we are continuously looking at avenues how we can expand the scope of health insurance. It is not only targeting some trying to give some high net worth individuals some policies and trying to showcase growth. We are trying to genuinely cover the maximum population as possible, the needy, and people who need health insurance. So similarly, we brought bariatric surgery for the first time in the industry as part of the health insurance coverage a few years ago. Now, of course, it has become almost a norm, but these are innovation which was brought by Star Health Insurance. And in terms of technology, Star Health Insurance is one of the highest spenders of technology in the Indian general insurance industry. We are spending a lot of money on technology to improve our customer services. Over 5 million customers have downloaded our Star Health Insurance app. They are using our services through the app. We have a unique AI-powered face scan features where in a matter of 60 seconds, the customers can get to know what is their health status. And a lot of health readings are given them at the click of a button on our app. Similarly, a lot of underwriting automation is done. We have a centralized process where all the proposals which are coming for new applications of insurance flows through an automated AI powered engine which goes to our medical underwriting team, and based on that they are able to make sure that more and more customers are getting the policies as quickly as possible. So these are some of the things that we are doing to make sure that our customer experience, our customer engagement becomes better and better. One of the things that the regulator and the government is also driving is the NHCX platform, the National Health Claims Exchange. This is going to be a standard platform for all insurance companies, and this is being driven by the Ministry of Health. So happy to tell you that Star Health is one of the few companies which is already integrated with this platform, and as and when it becomes fully operational, we are ready to take the benefits of this platform. So this will result in better turnaround times in terms of claims payment. It will also help the hospitals in industry. Today all the hospitals have multiple companies with whom they are having integration. This will be one single point of integration for the hospitals also. So it will help them also in making sure that customer service is improving. So Tamil Nadu is number home state. We are very proud that we started from here and we have grown to where we are today. Our home state of Tamil Nadu, we have more than 50% market share. One out of every 2 policies in Tamil Nadu is a Star Health Insurance policy. We have done more than 2,000 crores of premium in health insurance in Tamil Nadu in last financial year, with more than 12.5 lakh policies have been marketed. So here we have a very deep presence. We have more than 90,000 agents who are working for us. We also have almost more than 120 odd branches, which is located in various nook and corner of Tamil Nadu. The leading cities, of course, being Chennai, Coimbatore, Madurai, Tirupur, Trichy. These are, of course, the leading markets. But of course, we are present in the smaller towns as well. Whether you go to a Dindigul or you go to a Tirunelveli or you go to a Tuticorin, Star Health office is present in all those places and even smaller towns. So that is what we are very wanted to showcase to you, that being a Chennai-based company, we are now very proud to be where we are, and we are trying to expand and create the same kind of presence in all the states in the country. Health insurance has always been a product which is felt that only if something happens, if somebody gets admitted to a hospital, then only the insurance company is called upon to provide the services. But we are trying to change that narrative. We are trying to become a healthcare partner or a health partner of our customers, that even if you claim, definitely we are available for you with all the services that we have showcased to you. But people who are otherwise not claiming also, how can we provide them services? And people who have become prone to illnesses, how can we improve their health? How can we partner with them in improving their health so that they do not have to fall sick again and again? So these are some of the wellness initiatives that we are driving, and we have 2 doctors who are here with me, Dr. Hari and Dr. Dheeraj. These 2 gentlemen are driving our illness to wellness initiatives. A lot of innovative things are happening here. We are doing a lot of preventive health checks. We are promoting our health checkups to our customers and telling them to please understand where they stand by taking health checkups. And last year, we are happy to tell you, 260,000 preventive health checkups were taken in our organization by our customers. So this is a 3.5x increase over the previous financial year. So promoting customers to go and take health checkups so that they can know where they stand in terms of their health, and thereby Star Health can help them or guide them to manage their health better. through our telemedicine service, which I have already spoken about. Our telemedicine service is not only giving consultations, we are also giving prescriptions, and we are also guiding them to take which kind of medicine and treatment, because we are running this with a team of qualified medical professionals. We are not, this is not just a customer service, frivolous. It is an actual guidance we give to our customers. More than 170,000 consultations were done in the last financial year, which is a 45% growth. Our wellness programs I have spoken about. We do have a large cohort of customers who are work with us and who are having various kinds of diseases. How do we make sure that our wellness programs help them to manage their health better through our diabetes management, our hypertension management, weight management, cholesterol management, mind and body program? We are encouraging more and more customers to enroll for these programs so that we can help them manage their health better. 21,000 enrollments were done in the last quarter itself in these wellness programs that we are promoting. And finally, it is but natural. Human beings will fall sick, and human beings will get admitted to hospital at some point of time. That is why we are there. That is why health insurance business is available. So once they fall sick, how can we make sure that we manage their health so that they don't have to get readmitted again and again? So this is a program that we drive called Preventable Readmission Rate Reduction Program. We handhold our customers who have just got discharged from hospitals, and we have specialized engagement with them so that they do not have to get readmitted again and again. So this is something that we do, which is a proactive post-discharge care management through our specialized team of doctors and consultants. And of course, not everybody falls sick. There are a lot of people who are really healthy, who buy health insurance, also take care of their health. What is in store for them? Our Star Wellness program actually gives up to 20% discount to customers who are taking care of their health and who are submitting their health records to our company through integration with our app, who are, through the wearables and trackables and other, equipments which they are using. If they are submitting their health information to the company is giving almost 20% discount to our customers through the Star Health app. So these are the kind of innovations that we have brought. Of course, some of this is being available with other players also, but what I can tell you confidently is our wellness program is not a standard run-of-the-mill program. It is beyond just wellness. It is also moving people from illness to wellness. That is the agenda that we are trying to drive through our condition management and wellness programs. And finally, friends, coming to the main agenda of today, we are happy to announce that we are launching our home healthcare plan or services in 50 plus cities and towns in the country. What is the home healthcare services that we are offering? This is the service. Basically, we are trying to move customers to understand that everything need not be an admission in the hospital. Sometimes the hospital itself can come to your house and give you all the services at your house itself. So that is the home healthcare service. Basically, it is a service which is, targeted towards increasing the comfort and provide personalized care at the home of the patient. What are the diseases that we are covering? Most of the infectious diseases are getting covered under our home healthcare program today, with almost more than 50 cities. These 50 cities cover 85% of our population, of our insurance customers. So almost 85% of the customers are now are able to avail these services. It covers all kinds of fever, gastroenteritis diseases, urinary tract infections, other vertigo and other things. We are also looking at phase 2, how we can increase the scope of these diseases to cover dialysis, to cover chemotherapy. There are a lot of services that can be covered at home today, and customers feel happy to take these services at home rather than get admitted in a hospital. So this is what we are promoting today. More than 50 cities across the country are getting home healthcare services from Star Health. End-to-end package. It is a 100% cashless facility. Customers don't have to pay a penny from their pocket, and the doctors will come to the house, the nurses will come to the house and provide them these services at their comfort of the house. So the partnerships, this is being driven through some of our partners, of course. So we have tied up with some leading partners who are specialized in these services, and we are able to provide these services. There's a lot of initial traction we are seeing across the country, very well received by our customers. Many customers are already availing of this, and we hope that with such kind of innovations and such kind of first in the industry type of products that we bring, our services will not only be a traditional health insurance services, but it will definitely be far superior than what is expected from the market itself. So these are the towns that we are currently covering, 54 cities and towns in terms of the towns that we are offering this home healthcare service. You can see the list here, but almost this towns and cities covers 85% of Star Health Insurance customers today. And as the days go by, we plan to expand this list into other smaller towns and villages. And not only that, we also want to expand the list of services that we are covering under this home health care. We believe that this kind of offering is unique in the industry, and this will be something that the customers will truly value, and they will be able to avail this offer at the click of a button by calling our call center or by registering the request on the Star Health app. So thank you so much for coming today, and I look forward to interacting with you, and any questions you have, we are happy to answer. Thank you so much, Nandri. Thank you.
What is the response time of the home care?
Yes, the turnaround time we are giving in 24 hours, right? Yeah, please come.
Vanakkam, Dr. Hari, Star Health 2009 joined panna. Vanakkam. Yeah. So basically what we do is a customer call call center. As soon as they call the call center, within 30 seconds to 1 minute we pick up the call center. We don't have a waiting time. And within 30 minutes we call the customer immediately. And then reaching home, it takes about 1.5 hours. And what we do is we specifically pick up cases where there is no emergency there, because all your fevers are not emergency, where you've never seen a patient going in an ambulance to fever at home. So we're very specific in selecting patients where there is no complication, so that they can wait for that 1.5 hours. City kulla vandu almost half an hour 45 minutes la vandrom. Konjam periphery ulla pogumbodhu vandu 1.5 hours agum. And whatever doctor that go, they are qualified MBBS above doctors, nurse who are completed the BSc basic degree nurse, and one interesting point vandu they have been supplied with pharmacy and lab test. Idukku unga patient veliya po venda, they didn't go out for any of these services, and end to end completely with a package with no out of pocket expense.
Is it an add-on facility or separate?
So currently we are giving this as a not an add-on facility, as a benefit without any increase in premium currently.
Okay.
So we wanted to have a pilot project, so we started in almost July, and customers from the Chennai, Delhi, Mumbai, they started to like it. So as of now, it's been given free of cost. And when you saw Tamil Nadu, right, you add infectious disease, which is almost the topmost. We pay 19% and the infectious disease. As a concept, if it goes there, it will help customers, and it will benefit hospitals in admitting patients who actually need admission also.
So all existing customers can avail.
Of course.
Without any increase of premium.
Right now. And going forward, we are also looking in bringing in add-ons, the way in which it's going to go. But currently, we are trying to pilot this and give it as free of cost to customers for now.
How to handle this infection?
It's limited to Star customers for now. But your telemedicine is available for all. But since it's a service where you have to pay some amount to the provider, right? So it's only for Star customers.
Is there a separate team for this service? Or
So basically, we have a separate team. So what we do, we have an in-house telemedicine team headed by Dr. Dheeraj. So he has around 25 to 30 in-house on our payroll MBBS above doctors. So they do the consultations. அவங்க தான் முதல்ல எடுத்து ஃபோன் எடுத்து கன்சல்டேஷன் பண்ணி பேஷண்ட்டோட சிம்டம்ஸை கேட்டு தே ட்ரையேஜ். எங்கே பேஷண்ட்டுக்கு ஆல்ரெடி இஸ் பீன் ஆன் மெடிக்கேஷன், ஓரல் மெடிக்கேஷன் ஃபார் மோர் தென் 5 days, அவங்களுக்கு தான் வந்து அட்மிஷன் தேவைப்பட்டு ஐவிக்கோ இன்ஜெக்ஷனுக்கோ ஹாஸ்பிட்டல் போவாங்க. ஸோ அவங்கள ட்ரையேஜ் பண்ணி ஹைப்பர் டென்ஷன், டயபெட்டிஸ் காம்ப்ளிகேஷன் இல்லாமல் வீட்டில் வந்து சக்ஸஸ்ஃபுல்லாக ட்ரீட் பண்ணவங்கள ட்ரையேஜ் பண்ணி we inform this to the providers. So we have around 5 providers, Portea, Cat24. They're all, Portea பார்த்தீங்கன்னா it's a listed company. Cat24 is a Japanese owned company. Japan home health care பார்த்துக்கிறது. So these companies have qualified doctors. We intimate them, and immediately doctor goes to the house within 1 hour. And we have an in-house team of doctors who call the customer during this waiting period. Because customers should not panic that this 1 hour no one is contacting. So we have a separate set of doctors who call, and every half an hour we have the GPS of the doctor reaching. So அதை கம்ஃபர்ட் பண்ணிட்டு டாக்டர் உள்ளே போகும்போது he will actually take medicines that are there, because எல்லா டாக்டருக்கும் தெரியும், he knows what medicine is required அந்த பர்டிகுலர் ஏரியாவில் ஃபீவருக்கு. ஸோ கொடுத்துட்டு தென் உடனே they arrange for a lab test, which the lab technician will come free of cost, test எடுத்துட்டு lab test to check whether the patient requires an admission, platelet if it's down you need an admission. நல்லா இருந்தால் வீட்டில் 3 to 4 days to 5 days ட்ரீட்மெண்ட் கண்டினியூ ஆகி நர்ஸ் எப்போ ஐவியில் ட்ரீட்மெண்ட் கொடுக்கணுமோ அவங்களுக்கு நர்ஸ் வந்துட்டு அந்த 3 hours when the IV is required, so they keep giving a nurse facility, and there will be a teleconsultation done in between. If required, doctor goes home every day also.
Sir, Sorry, infection.
Non-customer wanted to avail this facility, can you provide?
We can get this lead to the provider, sir. Provider business கொடுத்த மாதிரி ஆகும். So of course we can do that. But currently we are doing it only with our customers. But of course they can reach out to these providers for non-customers and avail that. If you actually see, sir, currently there are Chennai industry India பொறுத்த வரைக்கும், but the growth is going to be phenomenal. Next 10 years ஓட growth வந்து பார்த்தீங்கன்னா it's almost 30% of your admissions happening in hospital is going to go into home health care. So people போக புரியும். பயம் ஒன்று, அண்ட் செகண்ட் வந்து வி ஆல் ஆர் நோன் டு கோ டு அ ஃபேமிலி ஃபிசிஷியன். வாட் ஐ டூ, எங்கள் அப்பா இருந்தால் பண்ணாங்க, அதுதான் ஃபேமிலி ஃபிசிஷியன் இருப்போம். ஸ்லோவாக திஸ் இஸ் டேக்கிங் பிளேஸ் அண்ட் ஐ திங்க் பீப்புள் வில் ஸ்டார்ட் அண்டர்ஸ்டாண்டிங் த இம்பார்ட்டன்ஸ் ஆஃப் டேக்கிங் ட்ரீட்மெண்ட் அட் ஹோம்.
சார், இன் கேஸ் ஆஃப் இன்ஃபெக்ஷன் லைக் வந்து ரெஸ்பிரேட்டரி இன்ஃபெக்ஷனு ஒரு மாதிரி ஒரு மினிமல் ஆக்சிஜன் சப்போர்ட் இருக்குது, அது மாதிரி இருக்கும்போது நீங்கள் எப்படி அந்த மாதிரியான பேசிக் லைஃப் சப்போர்ட் எடுத்துகிட்டு போவீங்களா?
ஸோ பேசிக்லி நான் சொல்லுங்கள் சார். ஸோ பேசிக்லி சார் எங்களை பொறுத்த வரைக்கும் someone who requires 24 hours oxygen we admit them, sir. Because you cannot take a risk. ஏன்னா அந்த ஆக்சிஜன் சேச்சுரேஷனில் முடிச்சுட்டு வென்டிலேட்டர் which you call as BiPAP or something you might require. So we don't want to take a risk on that because as soon as infectious disease respiratory if they get admitted, first வந்து chest x-ray எடுத்துடுறோம். We bring in a portable or we take them nearby, rule out pneumonia, all those things. If oxygen supply is down, doctor pulse oximeter கொண்டு போவார். கோவிடுக்கு அப்புறம் everyone in the வீட்டிலே pulse oximeter வந்துருச்சு. ஸோ அதனால் that pulse oximeter வச்சு oxygen saturation 90 kilo போயிட்டா we admit them, sir.
So do you have specialty doctors in your team?
So basically what we have is telemedicine, we have specialty doctors like your pulmonologist, your oncologist, diabetologist and your general physician, sir. So poravanga will always be an MBBS above going home, and in case something goes as a complication is found, we have a required pulmonologist going home, but what we preferably do, we take them to the nearest network hospital. Yeah, because you have all specialty available there, so we cannot risk. See, pulmonologist coming home at 1.5 hours, 2 hours is not always feasible, sir. So we don't take risk, we are very clear. So we take them to the nearest network hospital, and interesting point enana, we get the claim also approved, of course, because anga poitone we make sure the admission is there. If they prefer to go to a non-network, we don't tell no, because we leave it to the customer sometimes, and we don't force customers to go to any hospital. But அவங்க கேட்டாங்கன்னா இந்த மாதிரி இங்கே ப்ரிஃபர்ட் ஹாஸ்பிட்டல் எங்கேருக்கு போங்க and we help them out, sir. And also,
just as a follow-up,
Yeah.
are doctors, comfortable going to home
So
services?
basically,
Because compared to the mindset of this generation with earlier, I mean, generally, I don't know whether they're
So I'll-
comfortable delivering home service. Have you trained them adequately? It could be very far from the place, or it could be somewhere in remote. So are they really, will they be comfortable in going
So-
to those doorsteps and deliver those services?
So I'll tell you one thing, sir. So you know how things works in life. 15 years back, what you had is coming back. See, all your family physician concept இங்கே இருக்கிறவங்களுக்குலாம் தெரியும். வீட்டுக்கு ஒரு ஜோஷியர் மாதிரி வீட்டுக்கு ஒரு டாக்டர். So அது it's coming back now. So எப்படி ஒரு bell bottom pant is now becoming parallels. நிறைய விஷயங்கள் is coming back, and people are இப்போ டாக்டர் ஃபெட்டர்னிட்டி பார்த்தீங்கன்னா there are so many colleges that's come up. And there are so many doctors who do not get actually a placement. Freelancing is not only for other department. Naanu paranga 2009 as a doctor I've come. I've been here with staff. So idhu kind of it's an alternative part. So people are starting to like it, and they are also comfortable, and of course they get a good 1500 kadikalam. They reach out to at least 10 patients in a day, 5 patients in a day. Income wise also it's feasible. And second point, customers are so happy to have a doctor at home, because that's where they feel comfortable, and of course doctors are treated well at home. So that makes a difference.
Also, this service really helps the senior citizens.
Yeah.
Today we see a lot of senior citizens are living alone. Their children are somewhere else. So home health care service definitely is a very good value addition for senior citizens.
So Tamil Nadu la pathina Athulya, which is known for senior citizens, they have 2,000-3,000 beds for only senior citizens. Avanga vandu senior citizens ku they are partnered with us.
But they have their own family doctors, right? Suddenly if a new doctor comes, though he claims professional doctor, but they will not be comfortable, right? Initially they have to speak their personal life, because they would have spoken to their family doctor for several years. All of a sudden somebody claiming.
So basically who are people, இப்போ பார்த்தீங்கன்னா after 100 customers, 50 will have a family physician, 30 will go to network hospital, 20% who don't have an option, they will obviously reach out here. எனக்கு இருக்க almost 10 customers will only reach out to me. That's obvious, because that's how it works.
You know the
So we are
history of
here-
patients.
So நீங்க கேட்ட கொஸ்டினுக்கான இன்னொரு ஆன்சர் என்னன்னா சார், most of the family doctors are placed out of clinics. See, when you look at India as a country, 60% of healthcare is provided only by clinics. And நம்ம வந்து என்ன இங்க ப்ரொவைட் பண்றோம்னா, we are providing a hospital at home. We're not saying that நாங்க வந்து உங்களுடைய family doctor replace பண்றோம்னு சொல்லல. Family doctor ஒரு பாயிண்ட்ல சொல்லுவாரு you need to get hospitalized, right? அது நாங்க we are replacing it by bringing these services to your house. So that's what we're trying to do here. Yes.
ஸோ சார் ஒரு சப்ளிமெண்ட்ரி கொஸ்டின் ஒரு இப்போ இன் கேஸ் ஆஃப் ஏதோ ஒரு இங்கே
Yeah, yes.
ஒரு இன்ஃபெக்ஷன் தட் மீன் ஒரு எபிடமிக் இஷ்யூஸ் ஒரு பிரேக் அவுட் ஆகுது இதாகும் பொழுது உங்கள் டாக்டர்ஸ் எல்லா பக்கமும் போவாங்க. தேர் ஆர் மெனி ஜீரியாட்ரிக் கேசஸ், பீடியாட்ரிக் கேசஸ் எல்லாமே இருக்கும். ஸோ தேர் ஆர் மைட் பி சம் சான்சஸ் டு எக்ஸ்போஸ்.
So I'll ask you the same question, sir. So we realized the same problem in during COVID, sir. Nosocomial infections and so on. So that is hospital-acquired infections. The probability of that is much higher. Let's say you're talking about a geriatric individual, 85-year-old or a lady, she's suffering with a disease at home. அவங்கள தேவையில்லாம ஒரு ஹாஸ்பிட்டல் கூட்டு போயிட்டு அங்க இருக்கிற ஒரு 100 இன்ஃபெக்ஷன்ஸ் அவங்களுக்கு வருது. அதை ப்ரிவென்ட் பண்றதுக்கு தான் the most important part is bringing home health care services. அதுதான் நாங்க ஸ்டாப் பண்ண முடியுது. And that is something நாங்க அப்சர்வ் பண்ணல சார். It has been observed by CDC in the US, right, where they found out that nosocomial infection was more it was that secondary infection which caused more death in COVID cases than COVID itself. அதுதான் நாங்க ரியலைஸ் பண்ணி that's when we started home health care services. We want to prevent that, sir. Yeah.
சார் தமிழ்நாட்டை பொறுத்த வரைக்கும் வந்து தமிழ்நாடு கவர்மெண்ட் வந்து ஆல்ரெடி வந்து இல்லம் தேடி மருத்துவம் டோஸ்க்கு வச்சிருக்காங்க. ஸோ அதுக்கும் உங்களோடதுக்கும் என்ன டிஃப்ரெண்ட் இருக்கு? அது வந்து என்ன வேறுபட்டு என்ன மாதிரி மருத்துவம் கொடுக்குறீங்க?
இல்லை சார், வேறுபடுத்து இல்லை, மருத்துவம் பொறுத்தவரைக்கும் வேறுபட்டு கொடுக்கக்கூடாது சார். என்ன ஒரே ஒரு விஷயம் என்ன இருக்குன்னா
அதில் இருக்க ஸ்கீம்ஸ் வந்து அதை வந்து குறிப்பிட்ட ட்ரீட்மெண்ட் தான் கொடுக்க சொல்லுவாங்க. ஸோ அதில் இருந்து நீங்கள் எவ்வளோ ட்ரீட்மெண்ட்டோ இல்லை என்னென்ன சிகிச்சை கொடுக்குறீங்க?
ஸோ நாங்கள்
நான் எடுத்துக்கிறேன். சாரி சார், இல்லம் தேடி மருத்துவமனையில் வந்து என்னன்னா சார், கவர்மெண்ட் ஆஃப் தமிழ்நாடு லான்ச் பண்ணாங்க. ஐ திங்க் கோவிட் டைம்ல லான்ச் பண்ணாங்க. அது வந்து ஓபி சர்வீஸ் தான் சார். ஸோ என்ன பண்ணுவாங்கன்னா வீட்டுக்கு போயிட்டு கன்சல்டேஷன் மட்டும் வீட்டில் பார்த்துக்கிட்டு இருந்தாங்க. அதுக்கப்புறம் வந்து என்ன மெடிசின்ஸ் தேவையோ அவங்களை கவர்மெண்ட் ஹாஸ்பிட்டலுக்கு அனுப்பிச்சிட்டு இருந்தாங்க சார். நாங்கள் அப்படி பண்றது இல்லை. நாங்கள் கன்சல்டேஷன் அவங்க பண்றோம், ஹாஸ்பிட்டல் சர்வீஸஸ் அங்கேயே ப்ரொவைட் பண்றோம். அவங்களுக்கு ட்ரிப்ஸ் தேவையோ இல்லாட்டி ஒரு மேபி ஒரு இசிஜி தேவைப்படுதோ எல்லாமே நாங்கள் அங்கேயே ப்ரொவைட் பண்றோம் சார். அதுதான் சார் டிஃபரன்சியேஷன் ஃப்ரம் இல்லம் தேடி மருத்துவமனைக்கும் எங்களுக்கும்.
மூலமாகவும் நீங்கள் இது பண்ணலாம் சொல்றீங்க. ரெண்டாவது உங்களுடைய கஸ்டமர் இந்த பாலிசி எடுத்துருந்தா தான் இது வந்து இதாகுமா, இல்லை நார்மலாக ஒரு பீப்புள் நான் வந்து நான் இருக்கேன், நானே இந்த ஆப் யூஸ் பண்ணி நான் எனக்கு வந்து அந்த அந்த ஃபேஸ் யூஸ் பண்ணிடுவாங்க
சார். டெலி கன்சல்டேஷன் யூஸ் பண்ணிக்கலாம் சார். பட் இந்த ஹோம் ஹெல்த் கேர் சர்வீஸ் இருக்குல்ல சார், 3 கஸ்டமர் கால் பண்ணாங்கன்னா அதில் 10 கஸ்டமர் தான் ஹோம் ஹெல்த் கேர் ஆகும் சார். மிச்சம் 80 கஸ்டமருக்கு டெலி கன்சல்டேஷனில் முடியுது. அந்த ஹோம் ஹெல்த் கேர் மட்டும் நம்ம பாலிசி ஹோல்டர்ஸ்க்கு மட்டும் தான் சார் உண்டு. பட் நீங்கள் ஃப்ரீ ஆஃப் காஸ்ட்டுக்கு டெலி கன்சல்டேஷன் பண்ணலாம் சார்.
அக்கார்டிங் டு யுவர் பாலிசி வந்து மெனி எக்ஸ்டென்ஷனல் இருக்குது, எக்ஸ்க்ளூசிவ் ட்ரீட்மெண்ட்ஸ் இருக்குது, சம் வெயிட்டிங் பீரியட்ஸ் எல்லாம் இருக்குது. இஸ் இட் அப்ளிகபிள் டு த ஹோம் கேர்
சார்? இப்போது இதில் இன்ஃபெக்ஷஸ் டிசீஸில் எக்ஸ்க்ளூஷன்ஸில் வராது சார். ஒரே ஒரு விஷயம் மட்டும் இருக்கும், நாங்கள் 30 day வெயிட்டிங் பீரியட் மட்டும் தான் வேவ் பண்ணுறோம். ஸோ ஆஃப்டர் 30 day வெயிட்டிங் பீரியட் நாங்கள் கால் சென்டரில் கால் லேண்ட் ஆகிட்டோன்னே நாங்கள் எங்களுக்கு எங்கள் சிஆர்எம்ல எந்த மாதம் பாலிசின்னு தெரிஞ்சிடும். எக்ஸப்ட் 30 day வெயிட்டிங் பீரியட், மற்றபடி எதுவுமே வைக்கல சார்.
லான்ச் பண்ணதுக்கப்புறம் எவ்வளோ பேஷண்ட்ஸ் வந்து
யூஸ்
பண்ணிடுறாங்க அந்த கான்செப்ட்டுக்கு?
சார் இப்போது நீங்கள் பார்த்தீங்கன்னா சார் கிட்டத்தட்ட ஒரு 6200 கால் வந்திருக்கு சார், லிமிடெட் ப்ரொமோஷனல் ஒர்க்கோட. ஸோ லிமிடெட் ப்ரொமோஷனல் ஒர்க்னா எங்களோட ப்ரொமோஷனல் ஒர்க் வச்சு நாங்கள் பண்ணதில்லை. ஸோ இதில் ஒரு முக்கியமான விஷயம் என்னென்னா சார், அவங்களுக்கு அந்த கிடைக்கிற தனிப்பட்டமான ஒரு சர்வீஸ் சார். ஸோ ஒருத்தர் ஒரு கிளைம் சர்வீஸில் நடக்கிறதும் ஒன்று, இதில் வந்து தனிப்பட்டமான ஒரு சர்வீஸ் கிடைக்குது அவங்களுக்கு வந்து ஒரு டாக்டர் பேசுகிறாரு, வீட்டுக்கு ஒரு டாக்டர் வராரு, நர்ஸ் வராங்க. ஸோ அவங்களுக்கு அந்த செல்லமாக சொல்லுவோம்ல சார், பேம்பரிங்னு தமிழில் சொல்லுவோம். ஸோ அது ரொம்ப வந்தனால அவங்களுக்கு அது பிடிச்சி போய், ஸோ இப்போ அதனால தான் வந்து எல்லா ரிக்குவயர்மெண்ட்னால தான் இப்போ வந்து 50+ போகிறோம் சார். இப்போ நீங்கள் பார்த்தீங்கன்னா தமிழ்நாட்டிலே பார்த்தீங்கன்னா எல்லா இடத்தையும் கவர் பண்ணிட்டோம். இப்போ அடுத்த ராம்நாடு போகிறோம், அதுவும் லிஸ்ட்டில் எல்லா இடமும் இருக்குது. பிகாஸ் அவங்க எல்லா இடத்துலையும் வந்து இதை விரும்புகிறாங்க. நாட் பிகாஸ் வி டோன்ட் ஹேவ் ஹாஸ்பிட்டல் சார். 16000 ஹாஸ்பிட்டல் வந்துருச்சு, எனிவேர் கேஷ்லெஸும் வந்துருச்சு. பட் இந்த வீட்டில் இருக்க சர்வீஸ் வந்து அவங்களுக்கு புதுமையாக இருந்து பிடிச்சி போனனால இதை வேணும்.
So how long are you trying to pilot this? Is there a period you want to?
So currently we are not set a target, sir. We want to reach out to the customers, and we have this monsoon coming out, sir. Next 3 months would be a monsoon season, and we want customers to avail this for their benefit more than us. So on the time work, I don't think we'll have anything put as an add-on, sir.
Just curious to know how long will this be available at free of cost, or are you trying to make this as add-on to the existing ones? Just
No, right now it is, we have no, as he said, we have no plans to charge separately for this service. It is part of all our products, all the 57 products that we have. This facility is available. We are only requesting the media to highlight this service so the adoption can be improved.
Exactly.
But why you targeted 50 cities? You could have selected 20-25 cities initially, then you can.
I'll tell you, sir.
We have done that. Our initial project, we had done it in select cities, and then now, yeah.
I'll explain, sir. So July we started with 2 cities, sir, to pilot in. We did one in north in Delhi, and then in south we started with Bangalore, sir. So then we tried and tested the service because anything you introduce new, you need to see how the service is. And then we reached out to 14 cities. Adala Chennai, Kolkata, Hyderabad, Bangalore vanduchu. So anga vandu or 5 months pannom sir. So anganda success vandittu people started to ask from the other cities sir. It was basically marketing requirements sir. So and customers requirement and customer were calling telemedicine and asking for home health care, but appo illama irundhuchu sir. அப்போ கோயம்புத்தூரில் இருந்துச்சு, திருப்பூரில் இல்லாமல் இருந்துச்சு, ஈரோடில் இல்லாமல் இருந்துச்சு. ஸோ வி ஸ்டார்டட் டு இன்க்ரீஸ் பேஸ்ட் ஆன் கஸ்டமர் கேட்டது தான் சார். இப்போது இந்த 50+ cities உங்கள் மூலிமா இஃப் இட்ஸ் ஆஸ் அ பெனிட்ரேட்